It's good to be back with all of you. Our academic year is beginning. The class of 2025 has arrived. Students are moving into their residences, classes are starting. This is a time of excitement and energy on our campuses, and it's been wonderful to welcome so many members of our community to our campuses over these past few days. There are a number of long-standing practices that mark the beginning of any academic year. New student convocation serves as the formal welcome to our new undergraduate students and their families. Our medical school, our graduate school, our law school all hold their own celebrations to welcome incoming students. These moments honor our academic mission. They provide an introduction into the life of our community. They remind us of the values we share, and they provide a foundation for our students to begin their journeys at Georgetown. At our new student convocation this past weekend, Jennifer Martinez Sanchez, a rising senior in the college and our McTighe Prize winner, shared a welcome on behalf of her fellow students, introducing them to the community of which they are now members.
I found strength, support, and love within a dedicated and vibrant intellectual community of professors, deans, friends, and mentors. But only through these experiences and conversations did I realize that home was not a place, but a feeling.
Dr. Andrea Whistler, the executive director of our Center for Social Justice Research, Teaching, and Service, and an associate teaching professor, addressed our incoming class on behalf of our faculty, offering her words of welcome and encouragement to our students, sharing the values that animate our mission as a Catholic and Jesuit institution of higher learning.
So please, take an early lesson from Ignatius. Find and choose friendship. Friends will help you appreciate that this world is real and that we need you.
As our convocation came to a close, our students recited the honor code and received their academic robes they will again don at the completion of their studies at commencement. As I shared with our incoming class, you are taking the next steps on the most extraordinary journey together, surrounded by some of the most wonderful people in the world, connected now to one another forever by virtue of your membership in this community. We are honored to share in this moment with you. Welcome to Georgetown. Now begins the work of our academic year. We've been preparing for this moment for many months. Last week, I described some of the decisions we made in support of our public health plans for this fall. Today, I'd like to focus in detail on our layered public health approach and share a sense of what our community can expect as we return to our campuses. I'd also like to provide an update on our plans for our testing protocol for members of our community. We are continuing to monitor the pandemic closely. We're closely following the DC Health and CDC guidelines, as well as the national and global trends related to the pandemic. Cases are continuing to rise. We are experiencing a fourth wave of the pandemic. You'll see on this chart from the Washington Post a 15% rise in new cases across the nation in the past week. Rates have followed a similar trend in Washington, D.C., rising just over 12% this past week. Just over 50% of all Americans are vaccinated. In Washington, D.C., the number is slightly higher. More than 56% of residents are fully vaccinated. With the rise in cases, we have also seen a slight rise in the number of vaccinations in the U.S. in the past few weeks, an important step in strengthening our individual and collective protection against COVID. Masking also remains a vital aspect of protection in addition to vaccination. There's been widespread attention on the importance of masking in schools to protect children too young to be vaccinated. The Food and Drug Administration has not yet approved the vaccines for children under 12. We're also closely tracking announcements made by the Biden administration regarding additional vaccine doses of the Pfizer and Moderna vaccines and are anticipating a similar announcement for the Johnson & Johnson vaccine. We are prepared to make adjustments to our public health plans as the public health guidance changes. Now, I want to focus in this presentation on the implementation of our layered public health program, what it means in practice for the members of our community. As I review our layered approach, I'd like to start with testing. We have a testing protocol in place focused on arrival testing and frequent testing for those unvaccinated members of our community. We also test immediately anyone who indicates they have symptoms and anyone who has been exposed to an individual with COVID-19. And at any point in time, any member of our community can request a test if they so desire. Our public health campaign, Every Hoya Everywhere, is helping to communicate reminders to our community so they know when they should reach out to be tested. Many students are doing their arrival tests this week, following travel to our campuses. While nearly all students are fully vaccinated, some of our international students did not have access to the vaccine over the summer and are scheduled to be vaccinated immediately upon arrival to campus. Anyone unvaccinated will be very frequently tested until they are fully vaccinated. We're reporting positive cases on our public dashboard at our coronavirus resource website. We are anticipating we will see higher case counts as we account for arrival testing of students, faculty, and staff over these early weeks of the semester. In the next few days, we will be launching a new asymptomatic surveillance testing protocol. We're learning more about the transmissibility of the Delta variant, especially as it relates to the COVID-19 vaccines. The vaccine's protection against severe disease and death remains extremely strong. We are seeing evidence that vaccinated individuals can test positive for COVID-19 and can still transmit the virus to others, even if they are asymptomatic. So our new asymptomatic testing protocol is intended to help us increase our awareness of COVID infection activity in our community in individuals who do not show any symptoms. As part of this new protocol, every week, a randomly selected group of fully vaccinated students, faculty, and staff will be asked to get tested. This approach will assist us in making decisions about whether or not we should expand our overall testing of those who are fully vaccinated or institute any additional interventions to curb the spread of the virus on our campuses. Anyone with symptoms will continue to get tested as soon as they identify symptoms, and anyone who has been exposed will be required to get tested. And in addition, anyone in our community can get tested at any time on our campuses at no charge. We continue to require everyone to wear masks indoors with very limited exceptions. This is an important measure in addition to vaccination to reduce transmission. Faculty who are lecturing in class and speakers at indoor events, if they are fully vaccinated and physically distanced, are permitted to remove their masks while speaking. All others should remain masked indoors. We're requiring masks to be worn outdoors for some specific events, particularly larger gatherings. If someone is unvaccinated, they should wear a mask both indoors and outdoors. All classrooms will continue to have cleaning supplies available, such as hand sanitizer and disinfectant wipes. We follow cleaning protocols established by the Environmental Protection Agency for SARS-CoV-2. Our public health campaign includes additional signs around our campuses reminding our community of public health measures like hand washing, mask wearing, and what to do if you have symptoms. Our heating, ventilation, and air conditioning systems have all been assessed to ensure that they meet CDC guidance and American Society of Heating, Refrigerating, and Air Conditioning Engineers standards for mitigation of virus transmission. We've upgraded building ventilation systems and installed ultraviolet decontamination systems to reduce airborne transmission. I want to turn now to density. Following CDC and DC health guidance, physical distancing is no longer required in our spaces. For our largest venues and events, we will provide some limits on the number of participants and encouraging gatherings to be outside whenever possible. We are reopening buildings on our campuses to members of our community at regular occupancy levels and reopening our main campus food establishments at full capacity. We have a health attestation program available for anyone in our community. This health attestation, called our COVID-19 Daily Check-In, is also a way for everyone in our community to connect with a care navigator who can help advise them about next steps. In our arrival testing, we have been identifying COVID-19 before an individual has an opportunity to spend time on one of our campuses. Residential students are moved into isolation to prevent continued transmission. We've also seen a number of our returning faculty and staff test positive, and they're required to isolate in their homes. A few quick reminders on isolation in quarantine. Stay home if you have symptoms or a positive test. Report your symptoms to our care navigators with our COVID-19 check-in survey. Our care navigators will be in touch to help you through the next steps. If you test positive for COVID-19, you will need to isolate for 10 days, regardless of whether you are vaccinated or unvaccinated. If you are unvaccinated and have been exposed to someone who has tested positive for COVID-19, you will need to receive a COVID-19 test in quarantine for at least 10 days. Fully vaccinated people who have been exposed to someone who tested positive do not need to quarantine. This is guidance from the CDC and the DC Department of Health. You will need a test 3 to 5 days after your exposure, even if you have no symptoms. And you should mask indoors in public for 14 days following your exposure or until your test result is negative. Our care navigators lead our contact tracing efforts in collaboration with the DC Health Department. If someone tests positive, our care navigators will engage with the individual and identify anyone who could be considered a close contact. Close contacts will be expected to take a COVID-19 test. And the final layer of our public health program that I wish to focus on today is vaccination. As I have shared in previous presentations, this is our most powerful tool against the virus. At Georgetown, we have established a vaccine mandate for all of our faculty, staff, and students, and the vast majority, already well over 90% of our community, has been fully vaccinated before the start of the academic year. Each layer of our public health approach provides our community an additional level of protection. I hope these details are helpful to you as we work together to fulfill our public health program and uphold our responsibility to one another and to support the health of our community. I wish to again welcome everyone who is joining our community and all of our colleagues and students who are returning to our campuses. And I look forward to sharing this year with all of you and to thank you for your continued efforts to protect one another.